So Nurse Brittany, you do a lot. You do group studies, you do one-on-one tutoring, you do maternity, fetal EKGs, neuroendocrine, respiratory. I mean, you're doing it all, delegation. You're doing all that content creation, and you are the head of our education and content creating as well too. So you had a student that passed recently.
Yes, Amber. Are you here, Amber? Let me unmute you.
Yes, I'm here. Hey.
Hi, how are you?
Good. How are you?
Good, good. So Amber won an hour tutoring session with me that was given away during Nurses Week.
Yes.
So how does it feel to finally be on the other side?
It feels amazing. It feels, when you're not on the other side, it feels like forever, and you feel in that space of defeat. And so it's such an incredible feeling when you finally get that pass on the other side and you're officially an RN. It's just like one of the best feelings in the world.
Yeah. What did you use to study of ours?
So I did, like 3 weeks before my exam date, I bit the bullet and did the live course, the May-June course. And then of course I had the tutoring session in there. And then I was able to connect through NCLEX High Yield with an amazing study group. Shout out to Emmy and Byrina. And we hit it hard, like every single day. We stayed on task every single day throughout the course. We did questions together every single day, and we just went balls to the wall. We had no lives for a long time.
That's the toll. That's the
exactly.
Toll, right?
And it paid off. So here I am.
What attempt was this for you?
This was number two.
Awesome. And how many questions did you get?
75 and up.
Let's go.
Yes, the first time I went all the way, and I knew it was all bad the first time. I'm just gonna be honest. But the second time through, like having done the course and having the study group, I knew as soon as it shut off, I was like,
you went in with confidence.
I got this. I was like, thank you, Jesus. I got this. I walked out and went on about my day. I did the trick. I got the good pop-up, and I was like, thank God it's over.
That's amazing. That's awesome.
Never want to do that again, but yeah, I'm glad I made it.
Last but not least, what's your advice for people on the other side?
Man, the biggest advice I can give, first and foremost, I'm in the Facebook group, which I know a lot of you guys are. Watch your words, watch what you say, and watch your mindset. A lot of times, especially if you failed the exam before, you get through this like feeling of defeat, and it sucks. It's the worst feeling in the world, especially when your peers that, you know, have graduated with you are passing the exam and you're not there yet. Like, that feeling sucks, but watch your words, watch how you think about, you know, just having a positive attitude to the exam. I tell my study group this all the time, like, the test is tough, but you're tougher. You're going to get to the other side. And so just watch your words, watch your thoughts. And more importantly, study to understand, not to memorize. I came out of school being a really, like, I can memorize anything and be golden, but this test does not allow you to do that. You have to understand. And one of the things that I loved about NCLEX High Yield the most was that it filled in those gaps between school and taking the test, and actually taught me how to utilize answering questions, especially how you say, Dr. Z, and how to utilize UWorld. I had UWorld before when I took it the first time, and I had no idea how to utilize that. And so, and like Nurse Brittany, you were great. We had a one-on-one session together. You kind of filled in some gaps, like, hey, this is what I would do. This is my recommendations, like just things that I didn't think about.
Yeah.
Not having that, right? Not having you, not having right. High Yield. And I will say this, Dr. Z, you always say this all the time, that your voice is so annoying, but let me tell you something. On that exam, it was your voice, Nurse Brittany, and my girls, Emmy and Byrina, like everything that we go through. Okay, yep, that's that. Oh, Dr. Z, that's, oh, we talked about this. So really, if you guys take the course, find a study group. That was probably one of the biggest blessings out of this, was finding them. And now, like, we're friends for life. We're already talking about, once they get to the other side, they're taking their tests coming up, we're going to have like a girls trip. And
yeah.
That's amazing. That's amazing. Well, thank you so much for sharing your story with us.
Congrats.
Congratulations. Best of luck with everything. You're going to make a fantastic nurse.
Thank you.